Well, the demand is growing for access to health care for local Native Americans. Underserved populations as well often struggle to access essential resources. The American Indian Health Center has been providing care to all underserved populations right here in San Diego. And joining us live is the CEO of San Diego American Indian Health Center, Kevin LaChapelle, to tell us more about this ongoing issue. Kevin, thanks so much for coming in. Really appreciate your time. Tell us a little bit about the services you provide. It's kind of all-encompassing there.
It is. So this is our 45th year anniversary, which is really nice.
Okay.
We do medical, behavioral, and dental, and also wellness programs. During the pandemic, our behavioral health just really grew a lot because of anxiety, depression, and things. And so now we're a learning organization. We have an amazing staff that really are passionate about what they do. And so we're trying to meet our patients where they're at. So we have a transportation team. Thanks to Previs for helping us with a program where we can send a team out and actually go and meet people in their homes. And so we're really trying to work on prevention and engaging people, especially for preventative, for checkups, for annual wellness visits, all of those kind of things.
How are you helping out the Native American population specifically?
The Native Americans, we have a lot of diabetes, for example, hypertension, obesity, and really working and really understanding the culture. And so we really provide that culturally sensitive and appropriate care, which is a game changer.
Talk about the demand for health care for the underserved population. How does that look?
There's huge demand, and some of it is a lack of transportation. It's also a lack of income for healthy food. There's all sorts of different things. So we partner with an organization, Coastal Roots, for example, and we can actually take fresh produce out to patients each month. And so we can do a lot of things to help and try to make an impact so that people can have better access to care and have better education and how they can prevent disease.
There's a lot going on at the health center. You guys are going to be doubling up, right? Or
That's
at least
right.
expanding quite a bit. Can you talk about the reason to expand and what that expansion looks like?
Sure. Right now we only have about 17,000 square feet. We see over 22,000 visits a year.
Wow.
And so we'll be growing into about a 58,000 square foot building. The great thing is once we move into that building on our property, we'll demo the current site and turn that into affordable housing for seniors at risk of being homeless that would also be our patients. So it'd be an amazing opportunity to really have a great impact in the underserved communities.
They'll be right there. I know you touched on it. The pandemic had an impact on the
Very
health
much.
center. Can you talk about the impact it had then and then what you've learned and how you've grown since?
Sure. I think it had an impact on all of us on our team. And so we really reinvented ourselves during COVID. And so our staff kind of hunkered down and said, yeah, we want to be known for having a major impact in our community. So we've done that. And then we've understood patients, and post-COVID, understanding the different needs. Telehealth, for example, we can do teletherapy for behavioral health, which is an incredible opportunity because people don't have to take a bus all the way down to the center.
Sure. If there's someone underserved that's watching this right now that's saying, look, I need to get my health checkup. What's your advice to them, and what kind of steps can they take to really be proactive and take care of themselves in 2024?
I think for us, go to our website, www.sdaihc.org, and contact us because we're going to engage you in your care. But the other things is, I think diet's a lot of it.
Yeah.
And so things like walking, taking stairs instead of the elevator, just starting to do incremental changes. Sometimes people try to do a drastic change and it doesn't feel that it's realistic. So I think those incremental changes, and we're willing to help them do that. We have a nutrition program as well with the nutritionists that can help with
Got to
diets.
take care of yourself in 2024,
Absolutely.
and you guys are there to help them out. The health center
Definitely.
is there for sure. And that website right there, sdaihc.org. All right, thanks for coming in. Appreciate
Thank you
it.
so
We'll be
much.
right back.